to the sepsis station, so I hope you have read the description sheet. Outside, do you have any questions?
None, Assessor.
Okay, so if you don't have any questions, then please define to me what is sepsis.
Sepsis is a life-threatening condition of body's response to infection that may cause tissue damage, organ failure, or even death.
Okay, so what are the signs and symptoms of sepsis?
The signs and symptoms of sepsis is sudden spike in temperature, increase in heart rate and respiratory rate, and may also patient may also experience confusion, Assessor.
Okay, so you may start the sepsis. When will you start the sepsis form?
So I will now start the sepsis form if there is any suspicion of infection and use of greater than equal to 4 or use of greater than and equal to 5 if the patient is on oxygen or exercising clinical judgment. So, Assessor, I will now start for the section 1, sepsis screen for nursing staff. I will take the suspicion of infection. And I will now move to section 3 for the patient presentation. So, patient presentation number 1 is not applicable to my patient. I will take my patient presentation number 2 for a respiratory rate of greater than 30 and my heart rate is greater than 130. I will also take the patient presentation number 3 for the respiratory rate of greater than or equal to 20, heart rate of greater than 90, and my patient's temperature is higher than 38.3. Also, my patient has comorbidities of DM and COPD, Assessor. So I will not go back to section 1 and take patient presentation 2 or 3, and I will escalate it for medical review. So for the section 2, the doctor will complete this section. The doctor might take respiratory tract assessor.
Okay.
So,
what are the microorganisms causing respiratory tract infections?
Bacteria causing a microorganism that cause respiratory tract infections are Mycobacterium tuberculosis, Streptococcus pneumoniae, and Staphylococcus aureus. So, I will now proceed to section 4. Take yes after medical review to section 2 plus in section 3. So, I will start sepsis.
Plus?
Section 2 plus patient presentation 2 or 3 in section 3. So, I will now start sepsis 6. I will complete it within an hour and I will document the time now as my time 0 assessor. I will now proceed to the sepsis 6, aim to complete within an hour. Take 3. I will take for blood cultures and suggest to do a sputum culture also and throat swab as my patient is having COPD. And I will take for blood test for the point of care of lactate, full blood count, urea and creatinine, liver function test, and coagulation profile. As well as I will monitor my patient's urinary output hourly, Assessor. And for the gift 3,
So what's the normal urine output?
the normal urine output is 0. The minimum urine output is 0.5 mils per kilogram per hour and the maximum is 1 mils per kilogram per hour, Assessor. So, give 3, I will monitor my patient's oxygen, maintaining 88 to 92% of oxygen as my patient is having COPD, and I will take fluids. I will take fluids if the patient is if the patient presents with hypotension. I will give 30 ml per kilogram of balanced salt solution within an hour. And if the patient is having hypoperfusion, I will give 500 ml bolus to run for 15 minutes to complete 2 liters within an hour, Assessor. And for the antimicrobials, as per local guideline, the doctor initially will give a broad spectrum antibiotics while waiting for the result, Assessor.
And then once the result of the culture will arrive, what will happen?
So after the culture arrive, the doctor may shift the antibiotics to narrow spectrum, Assessor. Okay, so I will put the time, the dose, and the time given, and ensure the patient has no allergy before giving the patient medication. So for the section 7, I will look for any signs of new organ dysfunction. In anyone is sufficient, I will take lactate if greater than or equal to 4 after 30 minutes per kilograms intravenous.
So what's lactate?
Lactate is a byproduct of organ as a byproduct of organ or sign of hypoperfusion, assessor.
It is a sign of, it is a byproduct of
It is a byproduct.
anaerobic
It is a byproduct of anaerobic
metabolism.
microorganism.
Metabolism
Anaerobic metabolism
that is
that is
produced during
hypoperfusion, assessor.
okay.
So I will also take for the respiratory. Then you need for oxygen to achieve saturation of higher greater than 90%, assessor.
Okay.
So I will take this is sepsis and proceed to section 8 for looking for any signs of septic shock. I will take if the patient is requiring inotrops to maintain the aminoarterial pressure of greater than or equal to 65. So this is septic shock. I will inform the consultant and contact the critical care right away. For the practical guidance, I will reassess the patient's clinical response frequently and reassess the antimicrobial therapy and the need for source control assessment. And I will file this document in the patient's notes.
So when will you use the section 9?
The section 9 is for the clinical handover of the doctor. If the form is not completed by the outgoing doctor, the receiving doctor might sign the section 9 and endorse, and the outgoing doctor should endorse using ISBAR communication tool assessor.
So why is time important in managing sepsis?
Time is important to prevent further deterioration of the patient, assessor.
Okay. And then which sections can you terminate the sepsis form?
I can terminate. Sepsis form can be terminated for section 2, section 5, and section 7, assessor.